Hi everyone. Hi everyone. Hope everyone's doing well. Welcome to Wellness Week. I am just going to be. Oh, there we go. Doctor to join us here in just a moment. I think he's just joining in now. There he is. Hi, Dr. Francella. How are you?
I'm good. How are you, Steve?
I'm doing well. Welcome. Thanks for joining me. So, just kind of talking to everybody here, letting them know what we're doing. So, this week again is our Wellness Week. With our focus, our theme this week is going to be take a moment. And today we're talking about our physical health and our benefits of exercise with Dr. Francella. So, first of all, let me introduce myself. My name is Steve Kopis. I'm the athletic therapy coordinator with our varsity program at Seneca College. And I work with all the athletes throughout the year and help out with our recreation side as needed as well. So Dr. Francella is our new sports medicine physician with us this year, just joined us over the last few weeks and is going to be helping us out with our varsity program. So Dr. Francella, I just want to tell us a little bit about yourself.
Sure, yeah. So I'm originally from the Toronto area, up in Richmond Hill. I went to medical school down in the Caribbean at Saba University School of Medicine. I did my residency, family medicine, and sports medicine training at the University of Toronto. And currently, I work at Cleveland Clinic Canada, and I do some emergency medicine up in Port Perry. In terms of my sport coverage, during my fellowship, did a lot of U of T coverage with basketball, football, hockey, and kind of worked professionally with the Toronto Wolfpack prior to the pandemic, and I've been involved with Canada Soccer and Canada Basketball at varying levels, under 19 and the Olympic qualifiers recently. So
Awesome.
happy to be on. Thank you for having me, and looking forward to working with the Seneca Sting.
Awesome. Yeah, quite the experience with it that way. I just wanted to quickly mention here too, with everyone joining in, we will be giving away a $25 well.ca gift card to one lucky viewer of this live. So we do have staff in the chat. They'll pick a winner and contact you if you've won through Instagram message after the live. So Dr. Francella, so like I said, today we're talking about taking a moment for the benefits of exercise. So first question I wanted to ask you a little bit about is, I mean, I think everyone knows that exercise is good for us, but they may not know why. Can you tell us your top three benefits to moving our bodies regularly?
Yeah, I think just kind of a little bit of a background. So obviously we know that physical activity has an incredible benefit for both our body and our mind. The World Health Organization really recommends between 150 to 300 minutes per week of moderate intensity activity. So that's something like, going for a brisk walk or playing doubles tennis, or you can do 75 to 100 minutes of vigorous intensity activity. So that's things like going for a jog, playing basketball, or going for a bike ride. And we know that like doing something is better than doing nothing.
Mm-hmm.
And so I think one of the most significant changes that they recently made in the physical activities, before they said you need to do these physical activity bouts in 10-minute intervals. But now they're saying it doesn't matter how long you do it for. Anything you do can go towards adding to that 150 or 300 minutes per week. So that's the most important thing. So even just simply, taking the stairs is counts as your physical activity. So, we know from our science that there's a lot of benefit to activity. So picking three is hard, but I'll try and do my best. I think the first one is it decreases your risk of chronic medical conditions. So there's evidence that physical activity can reduce the risk of more than 25 chronic medical conditions. And there's a clear dose response relationship. So the more you do, the better your chances of not having those conditions are. Usually around 33% risk reduction in early death and chronic disease in those people who meet or exceed that recommended amount of weekly physical activity. So these include things like diabetes, heart disease, cancer. So if you have things like a family history of these conditions, it might be a good idea to sort of start engaging in those sorts of physical activity. I
Mm-hmm.
think the second one probably is a little bit obvious, but it strengthens your muscles and your bones. But it certainly can't be overlooked. So I think engaging regular physical activity is both a combination of aerobic physical activity or cardiorespiratory stuff and anaerobic or resistance training, things like lifting weights. So the muscles in our bones support our body, they help us move. And that is critical in kind of just daily activities. So something like climbing stairs, carrying your groceries from the car, helping your parents or grandparents do something, or even carrying a child. And then, additionally, if you're in a career or a job that is physically demanding, so if you're in trades or you're working as a firefighter or something like that, it really, increasing your strength will let you perform your task better and perhaps even, further your career. And I think another important thing is that when you're in your college, you're developing habits and forming habits that will follow you through your life. So older adults who have stronger bones and more muscle mass are shown to have lower risk of falls, which is a major source of disability and injury. So if you set yourself up for success now by engaging in regular physical activity, you can develop some good habits and hopefully avoid those sorts of things as you get a little bit older.
Yeah. Awesome.
Yeah. So I would say then the third one, which is certainly not the least, but exercising and physical activity can actually make you smarter and improve your ability to learn new things. So just as we exercise to strengthen our skeletal muscles, we have to exercise to strengthen our brains. There's really been a lot of experiments that are done, mostly in mice, but some of it is translated to humans. And we know that exercise can affect our ability to learn in about 3 major ways. So it optimizes our mindset, it primes our brain, increases our attention, our alertness, and our motivation to learn. The second one is that exercise actually increases a molecule in the brain that's called brain-derived neurotrophic factor, or BDNF. And what this does, it prepares and encourages our nerve cells to create new connections. So it's a concept called neuroplasticity. So it's essentially like miracle grow for your brain, and it helps your neurons take in information, process it, and remember it. So by exercising, we can actually increase our rate of learning. And then finally, the exercise actually has this incredible ability to create new nerve cells in a process called neurogenesis. And so the nerve cells are formed from stem cells that are in a part of our brain called the hippocampus, which is where memory is stored. Okay, so there's no like magic prescription for exercise to kind of increase learning, but if you just kind of start a simple, 20, 30 minutes, a couple times a week, add in more of a complex movement, so like a sport or something where you're doing something more coordinated, it can really help that. So I think, all in all, like, scientists are continuing to spend their lives on this, but there's a lot of benefits to activity. But if you can help yourself live longer, live stronger, and become smarter, it's a pretty good place to start.
Yeah, absolutely. I mean, so many different benefits there with it, especially with our student population there, right? And helping with studying and everything that way, right? Like good little study breaks to get out, do a little bit of exercise in, better focus and concentration on your studies as well, right? Awesome. So that kind of talking about the brain health of it actually kind of leads into our next question on it. Mental health has been discussed and brought to the forefront in many discussions with COVID-19 and the pandemic, and even most recently with athletes in the Olympics that have withdrawn from competition due to their mental health concerns. How does physical health affect our mental health? And you kind of touched on it a little bit there, but
that's a great point. I was actually just gonna bring up the examples in the Olympics and Simone Biles and Naomi Osaka and those guys, and they're underscoring that mental health really affects all of us. Doesn't matter how high a level of athlete you are. It's important to look into it. So I mean, it's certainly complex, and there's a lot of different contributing factors to mental health. But certainly one of the best tools we have to improve it is actually physical activity. So there's been a number of physical trials that actually show that physical activity is as effective as certain medications in treating anxiety and depression. So, starting with anxiety, when people feel anxious, they develop symptoms, they get fast heart rates, they become sweaty, they feel tense. And if you think about it, that's kind of what you feel when you're exercising, right?
Yeah.
So the difference is, how do we interpret these feelings? So if you're exercising, we can kind of teach our brain that the symptoms that we're having don't always spell doom and despair. So it's kind of like rewiring your brain to kind of understand and interpret the symptoms that you're having. Additionally, exercise releases a calming chemical known as serotonin. So a lot of people may be familiar with serotonin. A lot of the medications that we give for anxiety and depression are called SSRIs, or serotonin reuptake inhibitors, and they are trying to increase the levels of serotonin in the brain. So if you can do that with exercise, why not do it with exercise instead of taking a pill, right? Additionally, again, muscle tension. So exercise can help to lower our muscle tension. And in some larger studies overall with anxiety, people who exercise had about a 48% reduction in their symptoms. So
Awesome.
yeah, so anxiety is one thing, and then obviously flipping to the other side is depression, right? So we know that exercise is beneficial in treating mild to moderate symptoms of depression. Again, it kind of diverts those negative signals because in depression, we're usually not really motivated. We don't want to do things. Again, in another study, about 30 to 50% of patients had an improvement in their symptoms with exercise. And actually, as I was kind of doing a bit of preparation, there was a recent article that just came out in the British Journal of Sports Medicine about exercise and depression. And they showed that people who are physically active are less likely to have depressive symptoms. And also, moderate to vigorous activity is associated with lower odds of depression than light exercise. So this is where we say, a little bit is better than nothing. But in this case, a little bit more is probably better than just doing a little bit. And I think a big, another thing is sleep. So, that's part of our mental health is regenerating when we sleep. And we know that exercise can improve our quality of sleep. But we do want to make sure that you're not exercising too late in the night because you get endorphins and it can kind of keep you up. So, I think overall exercise is super important. It's going to increase your self-esteem, your quality of life. And sometimes that's the greatest predictor of mental health.
Absolutely, right? So, I mean, you get the physical benefits of it, plus all the chemical releases that can help us with our mental health as well. Onto excellent. Now, I mean, obviously, all those things come into play, and our own physical health often gets put onto the back burner with how busy our lives are and everything going on. So, what are some barriers you see people making their? What barriers do you see that some people are making their physical wellness a priority?
Yeah, I think you mentioned it. You hit the nail on the head. Definitely the most common one is just the simple word is time.
Yeah.
There's a great video by a physician named Dr. Mike Evans. He's from Toronto and has a bunch of these sort of online educational videos. And he
Great.
coined the term, 23 and a half hours. So can you complete all your daily tasks, such as working, sleeping, eating, watching TV in 23 and a half hours, leaving 30 minutes for physical activity a day? Now, it's a great concept, except we all know that activity isn't always just 30 minutes. You got to drive to where you're going, you got to shower, you got to change, you got to eat, all that sort of stuff. So I think really the important strategy there is just scheduling time in your day for exercise, just like you do for going to class or studying. And you can actually, as we talked about, you can make those things more efficient when you're exercising. That's probably the number one thing. I think, obviously with the pandemic, the main thing has been access to gyms, going to courts and other sort of finding other areas. So lack of resources definitely is number one barrier. And then I think, simply just knowing what kind of exercise to do or which is the best for you is probably the third one that I would say is a big barrier.
Yeah, and ultimately, some of that is just trial and error and get up and do something, right? And like about it, those small doses. And Melissa made a comment there in the comment section about microdosing the exercise, right? So you don't have to do all at one time. Taking those little breaks and doing little bits here and there to help yourself, right? And scheduling
Exactly.
it.
Yeah.
Awesome. So finally, what piece of advice can you share with our Seneca community to help us feel our best?
Yeah, I mean, we've talked about it a whole lot. I think the number one thing that I can say is to just be active, and that's it. So if it's just building it into your day, taking the stairs instead of taking the elevator, setting an alarm where you're getting up every 30 to 60 minutes to do a simple stretch, and you just want to lower the amount of sort of sedentary time that you're having. So we're getting away from more of the sitting, because you can be active while sitting, especially, those individuals that have physical disabilities. If they're in a wheelchair or whatnot, you can certainly be active and you're still sitting. So sedentary time is when you're sitting and doing nothing, basically.
Yeah.
So you don't need to be fit. You don't need to do a triathlon. You don't need to be an Olympic athlete to get the benefits of physical activity. So some is better than nothing, but more is better. I think the other things I would recommend if you are starting is starting at a lower level and sort of gradually building up. And again, if you have underlying medical conditions or anything like that, please make sure that you follow up with your family doctor to make sure that's safe. And then like we were talking about with some of the barriers in terms of scheduling, one strategy is to kind of write out a schedule to sort of build in 30 minutes of activity, see how it goes for about a week and see where you can sort of maneuver things. And then, as you mentioned, find an activity that you enjoy. That's the number one thing. Something that you can repeat over and over again. If you can find a buddy who can motivate you and you guys can hold each other accountable, that's also important. And, I think one of the benefits of the pandemic has been the access to home workouts and lots of things on YouTube and Instagram and on all those sorts of things. So you don't need, heavy gym equipment. You can just use your body weight, and there's lots of things online that you can find. So I think those are the main thing. I mean, physical activity has definitely far-reaching benefits in all axes. So just make some schedules, keep it simple, keep it fun, and you can get those benefits too.
Awesome. Yeah. And we have all kinds of different routines and programs and everything like that on our website and our Instagram account that we've posted and stuff of different strength routines with our coaches and meditations and everything along those lines as well. So easy to kind of pull up some of those through our Instagram account as well if people have trouble with those accesses. So that was great. Thanks, Dr. Francella. I really appreciate you joining us. Just a reminder, everyone, that we do have special guests all week at 12:30 on our Newnham Rec account. Tomorrow, our strength and conditioning coach, Sarah Donato, will be taking you through a mindful meditation and stretch session. So join in at 12:30 to get a bit of a stretch and meditation in with her. And again, thank you, Dr. Francella, for taking a moment with us today and discussing the benefits of our physical exercise. Appreciate it.
No problem. All right.
All right. Thanks.
You're welcome. Take care.
Everybody.
All right. Bye.